Making a difference in healthcare requires collaboration between researchers, startup founders, and policymakers. This is what Delta is about, hosting conversations with leaders on the path to serious innovation. Hello everyone, my name is Rupen, and I'm a physician on a journey to meet people who are making a delta in healthcare. Hey Matthew, and welcome back to the podcast. Hello everyone. Today I have a very special guest with me. We met many months ago, actually. I met Matthew on LinkedIn and we talked about what they were developing. And a while ago, I wanted to reach out again to them and see where they are. And actually, they achieved great milestones. But I'm not going to weigh in or jump in. Actually, I'm just going to let Matthew talk about him, the company, and the product. Matthew, do you want to tell people what you guys are building at Diabetic U?
Yeah, thank you, Ruben. Pleasure. And thank you for having us on. So at Diabetic U, we are actually in the process of building multiple steps of a platform. The first part of Diabetic U is our Diabetic U application, which gives users with diabetes the ability to manage everything with their diabetes in one place. So we have personalized meal and exercise plans that we create for users based on their health data and the information they put it and where they're at in their diabetes journey. We also connect with about 300 plus different wearable devices. We are partnered with Dexcom for the G6 and G7. We connect with multiple different other diabetes devices as well to get just regular glucose readings, as well as your fitness wearables like Samsung Health, Fitbit, Apple Health, Garmin, and digital weight scales to be able to bring and import all that data. Display that data in one area so a user can see how all the things that they're doing with their diabetes are affecting them both positively and negatively.
Sweet. Sorry, go ahead.
No, I was saying that, and that's the first part of our platform. With that, on the second part, what we're actually going to build out is our telehealth component, which will give users the ability within the platform to meet with certified diabetes educators, registered dietitian, nutritionists, so that they can create a care plan that's personalized to them and where they're at in their journey based on the data that they're supplying through the application as well.
Awesome. So like if I'm a patient with diabetes, through this app, I can access everything related to my healthcare rather than going and jumping through the Dexcom app, the Fitbit app, the Apple Health app, I think I used Jeffit in the past for gym, and there's the other apps to monitor your calories and stuff. So everything is in one place.
Yes, absolutely. And that was the overall goal of the actual platform, was to be able to put it in one place and to be able to take that and show the analytics on it as well. So not only is everything in one place, but you're also able to see the data and the cause and effect in one place of how all the different things you're doing, especially from a good part, when you're eating the right things and then you're doing a walk after dinner and, drinking water, you're able to see the cause and effect of all those positive things that you're doing directly within the application.
I love it. I was wondering, do you have the product or software with you so you can share it and we can see how it works?
Yeah, absolutely.
All right. Do you want to share your screen and we can show people what you guys are building?
Absolutely. So we'll bring it in right here.
So here we have user interface.
Yep.
Okay, can you walk me through the user interface? Like if I open the app, okay, what are the things I'm seeing right now?
Yeah, absolutely. So the first thing you'll see at the top of our bite-sized lessons, and there are short form videos, usually between 45 seconds and a minute, on different tips and tricks for managing diabetes. We try to keep it short and interesting so that users are engaged. The second section that you'll see in there is your fuel and flow. That actually houses your schedule for the day. So you can see here, this is actually my schedule for the day. I had medication this morning. I added my breakfast in. I just had a nice hot tea for breakfast. And then you'll see my lunch in there as well, and what I'm having for dinner. I didn't put my exercises in there for yet this afternoon, but I will put those in there after I have my exercise after dinner. Looking at your next area on the home screen, you have your glucose insights, right? And this just gives you a screenshot of where you are with your glucose your last reading, your time in range, your percentage of glucose change. I've actually was pretty good at last week, so I didn't have much of a change. And then going down, we have our activity zone, right? And this is where you have your calorie tracking, your water intake, your medication, your weight, and your steps. This does connect directly. The weight does connect directly with. I have a Withings weight scale. I step on the scale, and it automatically just imports my weight into the application. And then you can see I only take one dosage of metformin myself. As you can see there, I don't have any dosages of medication left. The next area here we have is both our explore meals and explore exercises. We have a host of different meals that are all diabetes friendly meals. You can go through and search them, look at the different meal options. You can open it up. You'll see the actual calories and all of the different macronutrients, as well as the ingredients and cooking instructions as well. You are able, though, and what we have provided is to be able to create meal and exercise plans as well. I will show that right in 1 second. But the first next part of that would be our education station. Our education station is another format of our bite-sized lessons, but where our bite-sized lessons are short, impactful videos with education on diabetes, our education station is just more built out. It's a longer format, so you can read in more detail about different aspects of diabetes education. Going into the plan, like we discussed, you're able to come in and create a meal plan. Here, this is already my plan for the week. I can actually make changes, on if I wanted to do a snack and a breakfast, lunch, and dinner, it would create that meal plan based on those 4 meals. If I wanted to do 3 meals, I could do 3 meals. Here, I have it set to 3. So I click on new and I go through the personalization process. If I go through the personalization process, I can select the different things that I don't like. As far as ingredients, if I have any allergies, I don't eat fish, so I have fish selected. And then I can select different cuisine styles that I like. And if I wanted to add a few in there, I could do that. Click update, and it'll actually create a meal plan for me for the week. Now, what it'll do is it'll give me multiple different options for every meal. And then I can go through and see, if you see the one that's circled in blue, those are the ones that are suggested. But you can look through any of those. And if I wanted to eat the curry chicken salad instead of the low sugar Korean barbecue, I can take a look at it and then just select there. Once I've gone through and I like all the things for my plan for the week, I just click add to my plan. I'm not going to do that because then it'll change my plan for the week. But once I do change the plan, it will add that to my plan for the week. You can go back here to your fuel and flow section and you'll see that plan in your meal plan for the week. We do have that adding exercises in there as well. I don't have any exercises in there because I do my own routine. But if I wanted to add exercises in there, it will create the exercise for that in the plan as well. Going into our glucose section, we do have our glucose section where you're able to look at your glucose analytics and you'll be able to see all of your glucose data, for the day. You can see what you had for those days as far as any food items or exercise items. As you go through and scroll through, you'll see, here's medication. It'll show you what you actually took. And then you can see directly on here the cause and effect of those different items. When you have your exercising in there, it shows as well. We're actually building out a new feature right now, and that should be released in about 2 weeks. So currently, since we're hooked up to the different fitness applications and the fitness wearables, it'll track your steps currently, right? And it'll tell you what your steps look like. We're actually adding a new feature next week that will release in about a week and a half, that anytime you actually do an exercise, it'll log it as an exercise within our application. So not only will it track your steps data, but if you go for a bike ride and we notice that you did a bike ride, it'll actually auto log that into your glucose screen as well to show you when your exercises are. You're on mute, Ruben.
So this is really cool. I'm just wondering, like, let's say I'm not diabetic and I do monitor my blood sugar. And can I just like use the app even if I'm not diabetic? But because like I have everything here, it's a one-stop shop.
Oh, absolutely. In fact, that is another spin-off that we will have from this application, because we are releasing a weight management version of this, and more of a health and fitness version of this, to whereas, people that are tracking their glucose, or just want to track their glucose and, monitor their exercise and their uh, calorie intakes and eating more healthy.
Awesome. Great. So I just want to shift gears back to you. Um, what inspired you to start the company? Like, what was going on in your life? Like, why did you start this?
Yeah, no, it's a great question. I definitely appreciate you asking. I'm going to turn off the screen here.
Yeah, we can log off the phone.
There we go. And just so for as far as us starting this, you know, it comes from a long history in my family. I've been in and around diabetes my entire life for about 30 plus years. My father had type 2 diabetes for 30 years. I helped, him through the process. I would test his blood sugar every once in a while. I give him insulin shots. And you really saw that the journey that he went through. I have a brother that also has diabetes as well, and has, gone through complications of dealing with it on his own. I believe he's had it for roughly 10 to 15 years himself. And then I myself was diagnosed with diabetes type 2 about 5 years ago. And it was going through that process. And really, I struggled, to be honest. From my standpoint, it took me a good 2 years, 2.5 years to really even understand what I was dealing with and get it under control. Uh, I felt like there was a big disconnect between me learning how to manage it and getting the proper assistance from my healthcare team. The when I was first diagnosed, it was a rough journey, because when I was first diagnosed, they may have told me a 5-minute conversation of eating less carbs, eating less sugar, adding some exercise and taking my metformin regularly, and then, coming every 3 months to check on how I was doing, with a Xerox pamphlet of, this is what diabetes is. And that really wasn't helpful. So it wasn't till about 2 years in where I ended up, my insurance company covered the Dexcom G6, and I got the G6. When I got that, that was a little bit of an enlightening period for me, because now I was able to at least see data and see how, being that, going from maybe testing 2 to 3 times a day to seeing my glucose levels every 5 minutes, I was able to see how certain things affected me. If I ate a certain, meal, or I did an exercise at a certain time, I was able to see the cause and effect of that. And that was good insight, but I did want more. I felt like I still needed more, because it's, although you see the data, it gets confusing when you're eating things that you think are healthy, and it doesn't, your glucose doesn't respond in a healthy way, or you're eating something that you don't feel is that healthy, but oh wow, it wasn't that bad for me. So I really was driving for more education, for more resources. And I also was like, okay, well, I want to pair this with something to be able to, get a meal plan, or to, understand what I'm dealing with a little better. So I started to look, at what apps were on the market. I didn't see anything that just fit right for me and gave me the ability to manage everything in one place. And for me, that was the aha moment. That was, you know, I feel like that I watched my father struggle with type 2 diabetes. I watched my brother struggle with type 2 diabetes. And a majority of it was from lack of resources, lack of education. And I saw myself go through that same struggle for the same reasons. And that aha moment wasn't, oh, hey, I really am going to go and, change the world and solve something. But I learned, it did become, I'm going to solve something for people like me and my family that are going through these struggles, that are going through this tough time, to be able to give them the proper resources to be able to manage their diabetes better.
Gotcha. I'm just wondering now, what is the type of food that surprised you the most? You thought it's healthy, and then like you're using the Dexcom, and then like boom, damn, it's like your blood sugar went up.
You know what? So I was a big, there's two things that were really, really surprising to me. Was
But
I would eat yogurt and fruit.
yeah,
With yogurt with fruit in it. And I always, I would always think that, oh man, that sounds like a pretty healthy, meal based on what you learned
yeah,
growing up. And the amount of natural sugars in there would really, send me to a heavy spike. And but then I also found like I would eat a 6-inch sub with on a wheat bread, and I would take off half of the bread, um, and it actually didn't spike me that bad. So I learned like, okay, well, there's certain things I can eat, and I think part of it too is the conditions have to be right. You have to be at a good level before you start. But I did learn that okay, well, I thought if I ate a 6-inch sub that that would send me through the roof because I knew it wasn't the best thing to eat. But I learned that hey, I can cheat every once in a while, and if I do it this way, it's okay.
really. So like yogurt and fruit. Like, what kind of fruit did you put in the yogurt?
So it's pineapples and I think it was a pineapple, strawberry, and blueberries.
Huh. Very interesting because I thought like strawberries and blueberries shouldn't spike your blood sugar that high.
Yeah, yeah, no, I was pretty shocked as well. But one of the things I've learned through this journey as well, though, is uh, every individual with diabetes, certain foods affect them differently. Yeah, I've seen where some people can eat an apple and it doesn't spike them that much, or some people eat an apple and it does spike them. So it's
Oh
interesting to
wow.
see how certain foods affect certain people, and I think that's one of the great things that'll come about as more and more that CGMs are a commonplace with people on the market.
So you had that spark, and then like you were interested like to create, bring something to the market. And what did you do next?
So the spark, it was a good 8 months to a year from that point of just ideation, and it seemed like wow, it is a very big task to tackle.
Yeah.
I'm working at a regular. I was an executive at a healthcare consulting firm for a while, and it wasn't that like, oh well, hey, this is just I got this great idea. I'm leaving my job, but so I ended up really going in pen to paper and really looking at if I would do something like this, what would it look like? Where would we go? How would we develop it? And then, after I really started going through it and I really started thinking about it and talking to a lot of, other people that have type 2 and, where their struggles are and what their needs were, I I started to, really come to the conclusion that, this is a platform that if we could create a platform like this, it will help a lot of people because a lot of people are struggling with the same problem. And it's not only that there's a lack of resources and lack of education. And it's funny to say that because there's not truly a lack of resources. There's so many great resources out there, but the connection from people to those resources just doesn't happen. And a perfect example of that, Rupen, would be until I started out on this journey, I didn't even of this company, I didn't even know what a certified diabetes educator was.
Yeah, yeah, I agree. I
And
agree.
I had had
It's a very
diabetes
huge
for
word when it
over
comes to
3
diabetes.
years at that point. So it's like, how could I go having diabetes for 3 plus years, meeting with doctors, and then it was never either put in place with a certified diabetes educator or even just let me know what they were and what they did. So, with that, I really look at, this was when I started to dive in, I was like, okay, look, this is an opportunity that we want to build. I believe I have a great platform, and I was ready to explore that option. And I left my company in December of 2022, and we started this in January of 2023.
Okay, so what did you do next? You left your company. How did you find the first person? Like, let's say today I'm sitting at home, I have an idea. I want to build a product. How did you find the person who coded your app? Did you have like coding background, or like did you went and like did a LinkedIn search? How did you find your other half? Let's put it that way.
You know, that was an interesting journey, because we went through multiple different ideations of that process. And at first, we were looking and we were, interviewing for UX UI designers and front end and back end developers. Um, and we were originally going to bring the team in house. Was I essentially first started putting ads on LinkedIn because I was, working on building out a team. So I, put in ads on LinkedIn for a CTO, and then ads on LinkedIn for both front end and back end developers and a UX UI designer.
And were you
And
planning like to pay them like out of pocket? Did you raise any money in the beginning, or like you're gonna do this out of pocket?
yeah, this was out of pocket, and
Oh
so
wow.
we were looking, and it was an interesting process, right? Because we looked at, all right, well, what is going to be the way that we tackle this? Are we going to work on it to build it in house? So what I did first is I ended up going and I hired somebody to just to do the wireframing. Let's get the idea onto an actual concept. We wireframed out the entire app. I think we did about 35 screens of wireframe of, okay, this is the ideation of the process, this is the user journey through the process and where they would go. So we did that first, and then we went into I end up bringing on a CTO as a fractional CTO, and that was probably the biggest blessing of all, because I feel like for what we're trying to accomplish and what we're doing, we had the perfect fit in our CTO that we brought on.
Gotcha. So I also like noticed in your team, you have like lots of good clinical advisors, people who know what they are doing. How did you build this team? Like, how did you make people believe in you and like join the team and help you to build this?
Well, that was the most interesting part about that. And I did that the same way. To be honest, I went on LinkedIn and I just threw ads out there. I wanted to build an advisory board, and that was really important to me, right? Because for myself, and you probably heard it in the whole journey so far, I had to go out and hire a CTO. I had to bring on somebody technical. I'm not technical. I understand tech very well. I learn fast, but I'm not going to be able to build something, and I'm not going to be able to advise through it unless I have somebody on my team that understands and helps me guide me through that process. So, it was very important for me. Two different parts was, one, getting somebody on the technical side that can really help drive this through. But then the other one was, look, I understand that we are building a product that is going to help people's health. And that product could not be complete unless we had a full advisory board of health professionals. So we really, our goal was to build out and have an endocrinologist, a certified diabetes educators, which we have three of them, registered dietitian nutritionist, which we have two, an exercise physiologist, and as well, mental health was really important to us as well. So we brought on a psychologist that specializes in diabetes as well. So it was really important for us on the clinical side, because we knew, okay, yes, we're building a platform from the technical side, but we're also building a platform that's about people's health. We need to have the right clinical team in order to be able to do that. So I really, went out heavily on LinkedIn. I was developing an advisory board, and I think the amazing thing about it for me was when I started talking to the healthcare professionals. And let me take one step back here, because I want to tell you one part of the process that we didn't talk about. When we first started the journey in January, what we did was we built out the wireframe like I told you, and we built out some ads, and then we went and did social media ads and a few different ads. We spent some money on advertising the platform, like and had people essentially pre-sign up if they thought this was a good idea, if they thought Diabetic U was a good idea. We advertised for about I think 3 weeks, 3.5 weeks, and we had
And
over
at that
1,000.
time, do you have a product or no? You were just like advertising,
Oh no.
like if you have leads, you were just like, if you like this product, sign up to our mailing list.
Yes. So that's exactly what we did. And the reason we did that was two-part. One, we wanted to, of course, see if there was a market fit, right?
Yeah, test the
And
market.
in that 3 weeks, we found over 1,000 people signed up, and And when I tell you, our cost per acquisition on that was very low to get that many people. But what was more unique about that is when they signed up, we sent out a survey, an automatic survey to everybody that signed up, because we really wanted to see if the people that were signing up, would be able to utilize the services that we were, trying to offer, and like the idea, and would use tech to manage their diabetes. There was a lot of different questions that we asked. And the most unique thing was, out of the 1,000 people that signed up, there was over 400 people that did the survey, which, I don't know if you know much
That's
about, and when you
40% answer. So in
engagement,
healthcare, yeah, like
yeah,
usually like it's around 30%. So the average 30% healthcare survey answering. So 40% is a really good number.
yeah, that was so impressive to me, and the feedback was staggering for us. It was everybody. There wasn't many people that took the survey, maybe 2% that had a negative idea of it. Everybody else, was absolutely, I need something like, I personally need something like this. One of the questions we asked was, how well do you manage your diabetes? And most people that answered were not well. And they really need something to help self-manage. So wanted to tell you that, to get back to where we were. So that was one of the unique things that we found, right? And then when we started talking to the healthcare providers, right, and we were, interviewing people for board advisory roles, they were just as hungry for a technology like this that the actual people with type 2 diabetes were. Right. We're talking to these professionals, and, these are your certified diabetes educators and your dietitians that are working with, people with diabetes on a regular basis. And they wanted this technology just as bad as the actual users with diabetes. And
Oh, wow.
that, going through that, and them, I guess, connecting with the journey, and our journey to why we created this, really created a unique situation that was led us to having what I would say is a phenomenal board. I could not be happier with the board that we have. They've been amazing all the way through.
Okay. And now, so we build the product. We have something very cool. I like the product, to be honest with you, and I think it's something that is really needed in the market. Like I've seen tons of patients with diabetes, and I haven't seen something that put everything together. Again, I haven't done my market research, but this looks very cool. So what is your strategy go to market? Is this something like you're gonna advertise for? Is this something that um, patient's gonna pay for it, insurance gonna pay for it? Like, how do you think the fastest way is to bring this to patient?
Yeah, it's a great question, Ruben. We are working on a multi-pronged approach when it comes to the go-to-market strategy. So there's a couple things that tie into this. And the first, of course, our immediate release of getting it out onto the market. Once we have about 2 months before we do our soft launch. And when we do our soft launch, it's going to be direct to consumer. That, we will do a nice discount at the very beginning to start to drive, the market adoption. And the first iteration of this on the market will be a subscription based product, right? So they'll
Yeah.
be able to subscribe to it. We do have a free model that they'll be able to go on and, see, different the meals and things like that. They just won't have the artificial intelligent virtual assistant. They won't have the meal plans that are developed for them, and they won't have the connection to devices. But they will have a free model that they can still utilize the product, learn, educate themselves, be able to, get learn and look at meals, add meals to their plan if they want. They're on their own. So there's still some good features there. That first version will be that subscription model. Moving on, we'll also be working on the other side from business to business. We're going to be targeting your smaller self-insured companies from the 2,000 to 5,000 employee range, with a per member per month model to be able to help them give an option to their their insurees for a diabetes management self-management option.
Very cool. I love it. I think, yeah, I think patients having directly access to this, it's very useful. And like, I feel like it's not only in the B2C space, even like a B2B space. Like we have now the AI scribes, like many companies are offering their service directly to physicians. You can bypass the hospital, you can bypass the insurance. So I think I think this is better just going down to insurance, because like people want something like this. People want to buy something like this. People want to have the insight. And as you mentioned, like having that insight makes a huge difference. I spent several months actually in diabetes clinic, and I've seen the difference between like just having the education of knowing what's working for you and what's not, remove the frustration part of managing your diabetes, and helps you to manage your diabetes much better. So I completely agree with you. So what makes this product, this software, different from the competition? Like, what sets it apart?
So there's a couple things, and I think that one of the bigger areas is where we're going as well, right? From the application and the technology that we have just in the platform, which that's as far as we're doing everything in one place, right? So you have your meal plans, you have your education, you have the connection to all your different devices, so you're getting everything within one application, which 98% of the technologies on the market don't do that part. But what's more important is, we're going to add the telehealth component, right? And where that's really going to change is what we're going to roll out after we add the telehealth component is what we call Diabetic U Total Care. And that is where now the telehealth component is also going to connect with their primary care doctors or their endocrinologists, so that they're all sharing data within each other and creating personalized care plans for the individual based on what their experiences are, what kind, how they're exercising, what they're eating, what troubles they're having, based on the data that's being shared through the application, to their providers.
So if I'm a provider, and I have like a roster of like 200 patients or 300 patients with diabetes, I can like have access in real time, see what they are eating, how they are exercising, and how is their blood sugar like.
Absolutely. So one
Wow,
of the
that's
things,
cool.
yeah. So the first part is this: we have reporting, right? So our users are able to send their reports to their physicians, to their healthcare providers, to be able to share their reports. We do up to a 90-day report. We can do a week report. They can customize their report on how they want it, and it'll show you everything. It'll literally go day by day. If they did a 90-day report, you'd be able to look at 90 days, and you'd be able to see how their glucose levels were on each day. You'd be able to see an overview of their all 90 days, which would tell you how many average minutes a day do they actually exercise? What is their average carbs intake for breakfast? What is their average calorie intake for breakfast? Their average carb intake and calorie intake for lunch and dinner? When do they usually exercise? How many average glasses of water are they drinking a day? And of course, what type of steps are they putting in every day? Are they adhering to their medication? Now, granted, all of this is them entering some of this information as well, so it does take the user entering some of that information. A lot of it we have auto that logs automatically, but there is some of that, like food intake, things like that, medication adherence. If they're logging that correctly, they'll be able to see all of those different things. And so that you can see that from the macro level. From a micro level, you could look day by day and see, okay, well, hey, let's look at any days that you had a bad day, and or you had a challenging day. Okay, let's see what you did there. All right, now let's look at your best days. Oh, here's what you did on your best days, and see how it affected your glucose levels on those days. So you're really able to go in there and pinpoint it based on those reports. I think our next step that we're looking at right now is to be able to tie some of this data directly in through the MR EHRs. So we're looking at that now.
I love it. No, because like I remember also like I've done like some diabetes clinic in the past, and like so like it's pain about literally, because like you open the patient's chart. So usually how it works is like providers have access to Dexcom or any other continuous glucose monitoring device, and like there are like different platforms, right? Like you have a patient on Dexcom, you have a patient on another platform, you have a patient on third platform. So you'll have like 5 usernames, and then you will have like 5 passwords, and they're going to go to each platform and then look at their blood sugar and then how they were doing. But you don't have access to any other data their exercise, their heart rate, their diet, and like it's really it's a hassle. And then the patient's gonna come, and then you're gonna sit down, and they're gonna review with him like the doses, if they're on insulin, the dose of insulin, when did they eat, and what did they eat, and why they have a spike, and when they have hypoglycemia. But now here, like one platform, I can access like, I don't know, mentioned like many hundreds of like diabetes measurement companies, and like I can access their diet, their exercise, their steps, and I can put all this together and I can make a plan, especially for patients who are in insulin, because this plan is important. Like for patients who overdo with insulin, they become hypoglycemic, which means like low blood sugar. For patients who are not doing it right, for young patients who exercise type 1 diabetes. So like now I can make the decision even before seeing the patient, because like it's all about the data when it comes to managing diabetes.
Absolutely. And for us, that's one of the overall goals. What our main goal with Diabetic U Total Care is the personalization of care. I'm sure of dealing with so many different types of patients. Everybody's different,
Yeah.
right? And one of the things that I think gets lost in translation the most is that lifestyle is a big impact on how you manage your diabetes. And I don't mean just your lifestyle, it also your family's lifestyle. For example, I have a decent sized family. I have, a wife and 3 kids. So even when I want to eat the best, sometimes the
It's
rest of the
hard.
family doesn't want to eat the best. As a perfect example, one of the things that I talk about a lot, we have a feature I didn't show you within the application. We have a AI virtual assistant where it does what we call smart eating assistance, where you can tap on it and say, "Hey, I'm going to McDonald's. I want to eat a Big Mac and a fry. What can I do to lessen the
That's
impact of
cool.
my blood sugar?" And it'll give you options. And one of the reasons that we developed that feature was because of me and my journey. And I have 3 kids. Both my oldest daughter and my son were in sports, so I was always hustling around the sports. And sometimes when you're in sports, it's not easy to plan dinner. And even when you plan dinner, and this would happen to me the most, I go my son's baseball game, we'd have dinner planned after the game, we'd go home and cook. But on the way home from the game, the kid's excited. He's, Dad, I want to go to McDonald's.
Yeah.
And it wins every single time. Great for him. Not the best decision for me, living with type 2 diabetes. So I was like, okay, well, how can I go through that and manage and go through that? Right. Well, I learned that, hey, well, okay, I can get a Big Mac and take 2 of the buns off of it and only eat 1 bun in the Big Mac and don't eat fries and just eat a 0-calorie drink and a salad. And go take a walk, a 15-minute walk, 45 minutes after. And, those are the kind of things that I learned, from going through that. But that's where you have to have that personalization and understand, from a healthcare provider point. If you know that and you know what their style is, you're able to help them make adjustments and understand how they can make adjustments and
Sometimes
personalize
even
that
you
care.
don't need to help them make adjustment, because like the picture is there, right? You know that 15-minute walk is going to drop your blood sugar by like 10 or 15 or 1.8. It depends if you are in Canada and the US. So like you start knowing, maybe it's not only the insulin that drops my sugar, maybe it's a 15-minute walk, maybe it's the 5-minute rowing, maybe it's a 10-minute biking. Maybe if I eat this and instead of maybe I can enjoy an apple or enjoy a chocolate, but and instead of letting it spike my sugar, I can jump on the bike and like do steady biking while I'm watching Netflix. So you start developing your own treatment.
Absolutely, absolutely, and then that can be reinforced and reiterated from the healthcare side as well, to really help personalize that journey. And it's one of the things that we're looking at a lot right now is slow lifestyle changes.
Yeah.
And lifestyle changes you can adopt. One of the things I'm not going to name the name of the company, but when I was in my earlier time of learning to deal with my diabetes, I went on a application and I paid like $40 a month to get just food plans and
Oh,
creating
wow.
customized meal plans for you. And you're able to put in what you were looking for. The problem is that everything was like chia seed pudding or, quinoa and dry chicken. And it was, the meals weren't good.
Yeah,
They were
yeah.
healthy, but they weren't good. And, for myself, I'm a foodie. I like good food. But I understand that I need to eat better, right? So I do manage well, but I can't just go eat chia seed pudding and be satisfied. I can't make that lifestyle change. If I really wanted to, of course I could, but I have not been willing to as of this point. So, but with that being said, when you're able to create plans and learn and give people options that fit them in their lifestyle, they're able to start to make those lifestyle changes that they adopt more and more over time.
I love it. Matthew, thank you so much for being here today. Is there anything else you want to add at the end?
Uh, I think the only thing, one, thank you very much. Really appreciate you having us on. And we are very, very excited about, getting ready to launch the first rendition of our application. So we're really, really excited about that. Anybody out there, if this is something you'd be interested in, within the next 2 months, we'll be doing a soft launch Diabetic U on the market. Would love to have you as a customer, but more importantly, also some people to bring in that feedback so we can keep creating a better and better platform for people that are struggling with their diabetes.
I love it. And when you launch the product, please also send the link to me so I can mention the below in the comments or in the description of the video and podcast so people can see the app and download it. Thank you so much. Appreciate it.
Now, thank you very much, Ruben. I appreciate you as well. Have a great day.